For persons who don't know what dengue is, and if you do get a dengue, the symptoms and what you should do, here is the Honorable Dr. Frank Anthony, Minister of Health, to give you an update about what dengue is, and if a loved one for you get dengue, how you should care for them.
So first of all, we have a number of cases of dengue. And right now it's not on the rise. What we are seeing is a decrease in cases. About a month ago, we had about 400 cases in a given week, but we have seen that drop off significantly. So now we're down to about 200 cases per week. So we're seeing a decline, and that's because we've been doing a lot of work in terms of fogging. So we have been, every night, once the weather permits, we've been fogging. When it rains, we cannot fog. So that's why sometimes, like yesterday, they were supposed to go out, but the team could not do the fogging because of the rain. But once it's not raining, we have teams in all of the regions doing fogging. With fogging, that is going to help to kill the adult mosquito. And then, as you know, mosquito, they have different stages in their life cycle. So at the larvae stage, we're also distributing a substance called abate, which you can put in stagnant water, and the larvae would be killed by this substance. So we have been distributing that to a lot of the NDCs, and because of that, we have also seen less of these larvae, forming. So I think what we've been doing over the last couple of weeks have been having an effect, and that might be one of the reasons why we are seeing a drop in the cases right now. We'll continue to do fogging. We have a 28-day cycle, so once an area has been fogged and once 28 days have lapsed, we'll come back to that area and do another round of fogging. So we have a team at the Ministry of Health in the Vector Control Unit, and we have decentralized team in every region that is doing this. So dengue is caused by the dengue virus. There are 4 types: dengue virus 1, 2, 3, and 4. What I think people need to know is that this virus is spread by mosquitoes. So if you have conditions where you're harboring mosquitoes, so if you have stagnant water in your yard, if you got a tire where water would get into the tire and form a breeding ground, then you're creating the conditions for the spreading of dengue, right? So that is why it's important that people clean up their yards, clean up their surrounding, make sure they don't have stagnant water, because then you'll prevent the mosquitoes from breeding and you'll prevent the dengue from spreading. So this disease is caused by a virus. Now, because you have 4 different types of virus, a lot of people might have been in the past infected with one of them. So let's say you were infected with dengue virus 1. If you get back a second infection and you're infected with dengue virus 2, what we noticed that on the second occasion, you probably will get a more severe form of dengue, right? And people have to be mindful of that, because on the second occasion, this can lead to hospitalization in some cases. So if you had a first episode of dengue, you need to be careful with a second infection or a reinfection. And I want people to understand that. Now, some of the common signs and symptoms are people would have fever, you will have muscle ache, some people would have pain at the back of their eyes, people would have things on their skin, like redness on their skin. And with some of the dengue fever, what would happen is that people can have bleeding. So if it progresses to bleeding, then you need hospitalization, because that's a serious condition, right? So these are the typical symptoms that people would have. Now, if you suspect that you have dengue, then the best thing to do is come to one of the health facilities where the doctors would be able to check your clinical symptoms and determine whether clinically you have dengue, but they would also confirm that by doing a test for you. So we have different types of tests that we can do. We can do a rapid test. That rapid test would tell us whether you have an active dengue right now or whether you have a past infection. So either way, you need to come and we'll do that test for you. We have some other tests that we can take your blood and send it to the lab where they'll be able to run it. But the rapid tests are the ones that we're using across the country right now. So far, over the last couple of weeks, we have conducted more than 8,000 tests. And of those 8,000 tests, we had a little bit more than 2,000 persons who have tested positive. Of those who have tested positive, some of them had a past infection. So not everybody who tests positive mean that they have a current infection, but we can disaggregate those persons who have a current infection from those persons who had a past infection. So the best thing to do is to come to the health center where the doctors would be able to make that diagnosis for you and advise you on your treatment. Now, generally how we treat dengue is we want the persons to use a lot of fluid, right, so that they're hydrated. And we want people, if they have fever, they can use Panadol or paracetamol for the fever. What we don't want people to do is to use things like ibuprofen, right? So if you use things like ibuprofen, that would react with your body and that possibly can cause one of the blood cells that you have called a platelet, that platelet to drop. And if platelets drop in your body, it can cause bleeding. I'm giving you a simple explanation, right? So the thing is, if you have fever, use Panadol, but don't use things like ibuprofen and that class of drugs, ibuprofen, Indocid, and so forth. So avoid that. But again, the best thing to do is to come to the health center where the doctors and the clinical people at the health center would be able to guide you in what to do and what not to do. The first thing you got to do is make sure they go to the health center, get the right diagnosis, and then we'll determine the severity, whether it's, they can be cared for at home or whether they can be, or they need to be hospitalized. In some cases, what we're seeing is that people start, they're keeping especially children at home, and then when they come to the hospital, it's actually that child is very severely sick. So it's more complicated when they come in at that point in time. So my advice, come first to the clinic, let the doctors make the determination whether you stay at home or whether we should hospitalize you, right? Once we tell you you can stay at home, then basic things. You use the Panadol for fever, you rehydrate, take some bed rest, and you should be good. But again, all of this got to be monitored properly. For the whole year, we have had about 239 persons in hospital across the country, right? Right now, we probably have less than 10 patients in hospital. And of the patients that were hospitalized over the year, we have had 11 deaths. 6 of them were children. So I just want people to understand, come to the hospital. If you have any doubt, come to the hospital. The doctors are going to treat you, right? This thing, we can manage it well. Dengue is not new to Guyana. We have been having cases of dengue from a long, long time. The doctors in the system, they know how to manage this well, right? So this is not a new disease. So what we need people to do, if you get fever and you get muscle pains and you get pain at the back of your eye and those sort of things, come to the hospital. Don't treat yourself at home. Come first to the hospital, let a diagnosis be made, and then we will give you the right treatment.